Hello, and welcome to the first training module for the Virginia Electronic Disease Surveillance System, or VEDSS. This module will provide an introduction into VEDSS and help you get acquainted with the system. At the end of this session, you should be able to describe the steps in the VEDSS training process, as well as the purpose and benefits of VEDSS. You will have an understanding of the importance of the security to the system, become familiar with the system navigation, and be able to locate VEDSS resources for additional information. There are 5 basic steps in obtaining access to the VEDSS system. The first step is to receive an orientation to epidemiology at the local or central office level, depending on where you are located. This should include a basic understanding of communicable disease surveillance and investigation, as well as participation in epidemiologic case investigations. Actual field experience will help you understand how VEDSS supports and fits into public health activity. This step may take several weeks. The second component in the VEDSS learning program, which explains how the surveillance system works and how it is used. The program may be done in person by a certified VEDSS trainer. Once you have completed the learning program, you will practice inputting investigation information into the VEDSS training system with a VEDSS trainer. The trainer will also assist you in completing your enrollment paperwork, which includes the VEDSS Access Authorization Form and the VEDSS Access Agreement Form. The last step of the process is the independent completion of evaluation cases in the training system. These cases will be reviewed by central office staff who will provide detailed feedback. If cases are entered satisfactorily, you will be provided with a login and instructions on how to log in. Access is granted when all steps are completed. There are a handful of modules included in the online training program. The modules focus on teaching you how to accomplish common tasks in VEDSS. After the orientation provided in this module, the training program explains how VEDSS functions as a person-based system and outlines how you search for and add a person into the system. The program then covers how to enter and manage lab reports and morbidity reports, how to manage your work queues, and finally, how to create and manage investigations. VEDSS stands for Virginia Electronic Disease Surveillance System. It is a centralized electronic database designed to capture and store records for reportable conditions for the residents of Virginia. It is centrally maintained and accessed through the VDH network. At the central office level, it is currently used by multiple divisions in the Office of Epidemiology, including the divisions of Surveillance and Investigation, or DSI, Immunizations, Clinical Epidemiology, and Disease Prevention. DSI takes a lead role in maintaining the system and works closely with its partners. NBS stands for the NEDS-based system. This is the software we call VEDSS in Virginia. NBS was built by the Centers for Disease Control and Prevention to provide states with a web-based, patient-focused system for disease surveillance. The software allows us to send information to CDC about notifiable conditions. It is currently used by more than 20 states or districts, including Washington, D.C., Maryland, West Virginia, and Tennessee. NBS promotes the use of public health standards for data and information systems. The primary purpose for VEDSS is disease surveillance. It provides access to reliable health information in order to make timely and informed decisions regarding public health and case management. VEDSS is also a tool for collection of data and case reporting in order to establish and monitor patterns of disease. By identifying patterns of disease and risk factors, surveillance allows us to take action to prevent disease and inform public health policy. VEDSS is used for reporting and notification. Effective public health surveillance begins at the local health department level. Local users receive reports of disease from healthcare providers via phone, fax, and mail. They investigate these reports and enter the case information into VEDSS. Users also receive electronic lab reports, or ELRs, that are automatically loaded into the system. When case criteria are met for certain disease or conditions, users submit a notification. Central office staff review the notification and approve it if it meets case definition. Once notifications are approved, the case information is sent electronically to CDC. We use VEDSS to communicate our morbidity statistics to CDC. Ultimately, the data we collect in VEDSS are published in a summary form and disseminated to others as part of the surveillance cycle. Most health districts publish statistics derived from VEDSS. Many publish newsletters to help communicate epidemiologic trends to their local healthcare providers. Similarly, the agency publishes monthly reports with disease statistics by locality, and more in-depth analyses are included in the VDH Annual Surveillance Report. CDC publishes disease statistics by state on a weekly basis in the Morbidity and Mortality Weekly Report, or MMWR, and also publishes a comprehensive annual report. The published numbers for Virginia reflect the case counts in VEDSS. Surveillance data should be as timely and accurate as possible for sharing with medical and public health communities, as well as the general public. By informing others, this in turn informs diagnostic and prevention efforts. There are several benefits to using VEDSS, including centralization and standardization of lab, morbidity, and investigation data across health districts. The ability of data allows for analysis and detection for epidemiologic trends within and across districts. ELRs allow for timely notifications for reportable conditions and prevent the need for manual entry. Using a centralized online database provides cost and resources savings. The system provides an appropriate security for protected health information, as discussed earlier, to help us meet the state and national reporting requirements. One of the challenges of using VEDSS is that it is a complex data system featuring a learning curve for users. Although VEDSS questions allow for data standardization, it is important for users to remain vigilant about data quality assurance. Now that you have some background regarding the purpose and benefits of VEDSS, it is time to introduce the live system and the training system. The VEDSS resource page is the source of most information on VEDSS and features the login link for both the systems. A link to the resource page is at the bottom of the slide. Only authorized users can successfully log into the live system, as we discussed earlier in the presentation. But the training site is open to all VDH users. To log into the training site, use one of the suggested usernames, for example, Training 1. There is no need to use a password. Throughout the training program, we will be encouraging you to access the training system to practice what you have learned. There are important differences between the training and live site. Training is for learning about the system and for trying new functions. You can't hurt anything in training. The training system is for test or fake data, never for real data, because training does not have the security features as the live system has. The report functionality is limited in the training system. The live system features multiple levels of security and is used for surveillance and investigation. The live system is not used for practice. Only real data should be entered into the live system. There are many reports available in VEDSS, and they result in the output of surveillance data used for epidemiological analysis. The difference between using test data in the training system and real data in the live VEDSS system underlines the importance of safeguarding public health information, or PHI. The data in the live system are PHI, and as such are covered by VDH confidentiality and cybersecurity policy. Whether the information is on a computer, paper, or other media, you must safeguard PHI. Once you gain access to the VEDSS system, it is your responsibility to maintain security, confidentiality, and integrity of the data to which you have access. That means unauthorized people should not be able to look over your shoulder and see the information in the system. Do not allow anyone to use the live system with your credentials, or your username and password are for you only. There are several layers of security in VEDSS to ensure that the data are protected. Logging into the production system requires a two-factor authentication using COV Active Directory and an in-house database. Users must have an active COV account and an active VEDSS account in order to log into VEDSS. There are three components to your permission in VEDSS: role, program area, and jurisdiction. You are assigned a role in the system which reflects your job duties and controls what you can do in the system. For example, your role determines whether you can view, edit, or add a record. Your trainer will help you identify the most appropriate role. You will be able to view records only in your assigned jurisdiction, which may be your health department or health district. Others may have access to view records at a regional or statewide level. You will also be able to view records only in the program area that you are assigned. Program areas are groups or categories of disease or conditions. Another security feature in the system is that it will time you out after a certain period of time of inactivity. 30 minutes in the training system and live system. Activity occurs when the user hits the submit button on a page when searching, running reports, or saving data. Monitor your time wisely and try to save the information as soon as you are able so that your work is not lost. 30 minutes is usually enough time to accomplish what you need. Before we get into the system, you should ensure that your browser settings are optimal for VEDSS use. VEDSS uses most browsers, Internet Explorer, IE, and Google Chrome. Ensure pop-ups are enabled and that your browser is in compatibility mode. This ensures that drop-down menus work correctly. Finally, the browser should be set to check for new versions of the page every time. This is called the page refresh. If the browser is not in page refresh, you may be viewing an older version of the page in the system or have difficulty with some functionalities. Instructions on how to check or change your browser settings are available on the VEDSS resource page as shown on the slide. Browser settings are important for both the training system and the live versions of VEDSS. Now that your browser settings have been adjusted, let's dive into the actual system. What you are seeing here is the VEDSS dashboard, or home page. We will orient ourselves starting at the top of the dashboard, then proceeding from left to right. The dark blue navigation bar appears on the top of every page. Underneath the navigation bar on the dashboard is the title bar, including the NBS version 531 in this instance. The patient search box in the top left is where you would search for a patient in VEDSS using the demographic variables, or search for an event like the lab report by its accession number. In the top center column, the My Queues box will feature different queues depending on your role in the system. Most users will have 3 queues. The first queue is called Open Investigation, the second queue is called the Rejected Notification queue, and the third queue represents new labs or morbidity reports that need public health investigation called Documents Requiring Review. Additional explanation of these queues will be provided in future modules. The box in the bottom center provides a graphic display of certain system metrics. Users can provide the metric display by choosing from the drop-down menu in the box. The box at the top right entitled My Reports will display information if the user has created personalized reports from available templates. Finally, the Notice box in the lower left has helpful notes on using the system and information on whom to contact for assistance. Let's talk in more detail about the navigation bar that appears on the top of every page. This includes a variety of links that allows you to navigate through the system. The Home button will always bring you back to the VEDSS dashboard. You can use the Data Entry button to search for a specific person or event. Clicking on the Open Investigation button will show you all the open investigations for the area you are authorized to see. We will talk more about these investigations in a later module. The Report button allows users to export data and perform analysis and quality assurance. Clicking on the Help link opens a new window with the CDC Developed Training Guide. Clicking on the Logout link will exit you from the system. It is important for security purposes to use the Logout link every time you exit VEDSS. Besides using the navigation bar to navigate the system, there are several simple keystrokes or shortcuts that can be useful when doing data entry or navigating fields. They are listed on this slide. Use the Tab key to move forward one field. Use the Shift and Tab key to move back one field. Enter will submit a record, and backspace moves you back one character within a field. These shortcuts are the same when used in most other systems. While you're in VEDSS, do not use the refresh or back button located in your internet browser. The image on the slide will show you the refresh button we are talking about. If you use the refresh button, this potentially creates problems with any record you are in the midst of creating or editing. So please remember, do not use the refresh button as a potential landmine. We have mentioned the VEDSS resource page several times, and we wanted to mention it again. After you complete this module, we encourage you to visit the VEDSS resource page to familiarize yourself with the resources on the page, including the resources under the training section. The notes for using VEDSS is especially helpful for new users. We have touched on several terms in Module 1 that may be new to the user. A user role is a set of permissions related to the ability to add, edit, or view certain records. The program area is a group of conditions and diseases usually related to the division or program that provides guidance and supervision for them. A program area is a group of conditions and diseases usually related to the division or program that provides guidance and the supervision for them. The examples of program areas include communicable disease, vaccine preventable diseases, and zoonotic environmental conditions. Health jurisdictions are covered by a health department within a district. You will become more familiar with the terms as you become more familiar with the system. Now to assess your learning so far in a knowledge check. What are the benefits of VEDSS? Cost and resource saving, standardization of data, complex system, identification of disease trends, meets national reporting requirements. The answer is all options. We have now reached the conclusion of Module 1. It is time to try out what you have learned. Please click on the resource link at the top right. Go to the resource page and familiarize yourself with the available resources and adjust your browser settings. Log into the training system and try out the navigation steps that we have discussed. Explore. We strongly recommend that you use the Module 1 activity worksheet that is also available through the resource link. We will see you in Module 2.